This coming week, I'm going to be speaking along with my colleague Rachel Hildebrand at the MAATA conference. It's a regional conference for athletic trainers and other allied health professionals. And we are going to be giving a talk there that explores the exposure and effect of repetitive head impacts on collegiate and high school athletes. We are going to be looking at how the hits that players take during the regular course of practices and games affect things like their balance, reaction time, cognition, and symptoms that they experience. As a speech-language pathologist, I have had extensive training in traumatic brain injury, so the assessment and management of folks who've had anywhere from a mild to a severe traumatic brain injury. But what we are starting to learn in the literature is that for our student athletes, they may not have to have a concussion or a more severe traumatic brain injury to have some small effects of those hits that they experience. And Rachel and I wanted to explore that a little bit further. When a person experiences a concussion, be it a sport-related concussion or a concussion that they may have from a motor vehicle accident or any other sort of blow to the head or body, there are a variety of signs and symptoms that we may experience. Some people may lose consciousness, but that's absolutely not necessary for the diagnosis of a concussion. But there is some sort of alteration of consciousness. So someone may be disoriented or a little bit confused. They may have trouble remembering what was going on right before they hit their head or something like that. Following that acute period, the symptoms that they experience can generally be categorized into sleep disturbance, behavioral disturbance, cognitive problems, or physical or somatic problems. That would be things like headaches or light sensitivity as well. I think we can divide our line of research into two main topics. The first one is related to concussion. So we've largely focused on student athletes, so people who actually sustain a concussion. And we are looking at how that concussion affects largely their ability to return to school, return to learn, return to life activities, and whether there are things that we can do to help make that process a little bit easier and a little bit more successful. The other side of our research is looking at these repetitive head impacts. So these are the hits that players take in the course of their regular play in sports like football or hockey or lacrosse or even soccer, and looking to see if those repetitive head impacts in the absence of concussion may still have an effect on their physical and cognitive behaviors. As we learn more about the kinds of activities that place players at risk for repetitive head impacts and also start to understand the effects that these repetitive head impacts may have, we can start to work with our colleagues in the coaching staff and in the athletic training world to think about how we can modify practices, sports, that kind of thing, to reduce the risk that these players have. So for example, we found in one of our studies that there was a particular drill that seemed to be a main cause of repetitive head impact exposure for our players. And we were able to communicate that to the coaching staff, and they've modified the way that they use that drill now.